Welcome to the launch of Public Pharmacare Now. My name is Avi Lewis. I am really honored and delighted to be asked by the Council of Canadians to host this meeting, the first of many. I want to start by letting you know that I live here in Quailquai, otherwise known as Half Moon Bay, in the traditional and unceded territory of the Sechelt Nation on the Sunshine Coast of British Columbia. And rather than just reciting a land acknowledgement as a ritual, I want to reflect briefly. There's a cameo from my kid, probably the first of many, on something that I heard recently from one of a teacher and mentor who's very important to me, a leader in the Tsleil-Waututh Nation named Reuben George, who many of you will have been side by side with in demonstrations against the Trans Mountain Pipeline and other important climate justice struggles. And I had the honor of spending some time with Reuben recently on Tsleil-Waututh land. And he talked to me about his own worldview and the worldview of his people being a reciprocal relationship with the spirit in all living things, with the land, with the water, with other humans and other creatures. And it made me feel the power of that accountability that we have to each other, to our environment, to our natural environment, and to the complex connective tissue of care that holds all life in its embrace. And to me, that's what tonight is grounded in, our accountability to each other and to all of us and to all living things. And before we dig into the big battle for public pharmacare now, I want to introduce Robin Tress, Co-Executive Director of the Council of Canadians, for a couple of quick introductory thoughts. Robin.
Thanks, Avi. Hey everyone, my name's Robin. I'm so glad to see you all here tonight. There's already 175 people on the call and it keeps keeps growing every second. I just want to introduce the Council of Canadians. I know many of you probably have gotten to know us over the last 37 years. But by way of introduction, over the last couple of decades, the Council's been challenging the agenda and the policies of corporate Canada, which put shareholders and CEOs' interests before the interests of people like us and our communities. And we believe that our democracy is under threat from the increasing consolidation of wealth and power in the hands of the few. And when it comes to pharmacare, it's never been more clear that that's the case. So, sorry, I'm just long here. Angela, can I have the next slide, please? The second one. Thank you. So in the last few years, we've been looking back at the first 4 decades of the Council's life and what we've learned along the way. And there's a few things that we've really learned that we're taking with us into the present and future and into this fight for pharmacare. We've learned that part of our big strength as an organization is that we are committed to organizing people around winnable and specific political goals and leveraging our power extremely intentionally on decision makers. We are intentionally building relationships and structure within communities so that we can continue to make bigger and bolder demands as we go and continue building the muscle together to win those demands too. We're investing in building the capacity and skills of the people who call the Council of Canadians their political home, which I hope is you. And we are prioritizing and centering the people and communities who are most affected by the issues that we work on. So these are some of the things we've learned from the last 4 decades of our organization and that will carry with us into this fight and many more in the future. Angela, can I get the next slide, please? So what this means for right now, for organizing for pharmacare, we know we need to be organized. You might have seen the news today about new levels of corruption within the what does that stand for? The Pharmaceutical Pricing Agency of Canada. We know how deeply embedded Big Pharma and the insurance industry is in this topic and in this fight and their control over the government of Canada. And so I'm saying this all now about how we organize because we know that in order to win public universal pharmacare, we need to be very organized together. And we'll need to demonstrate to politicians that they have to respond to us, the people and our communities, not Big Pharma or the insurance industry, or there will be political and electoral consequences. So I'm going to turn it back to Avi to talk more about pharmacare and how
I hope you continue to do that.
Great. I think we will, and I hope you'll join us. Avi, I'll turn it back to you.
Terrific. Thanks, Robin. That is it's a powerful introduction, because that is our task here this afternoon or this evening, depending on where you're located. We need to build power behind this timely and essential demand. Where to start when you try to explain to folks from other countries what it means to be Canadian? I know you've all had this experience. You say, well, actually, the most common national identity is a piece of public policy called universal healthcare. It really is the thing that Canadians reach for when they're searching for what it means to be Canadian. We're intensely proud of it, and that system is in free fall. We know that people can't find family doctors, that emergency rooms are disaster zones, and that the pandemic shredded the public health system, and we're all seeing the consequence of it in our own lives and relationships. And we're also seeing this being used in a classic incidence of disaster capitalism to advance the agenda of privatization, which was the force that Tommy Douglas first fought against in order to institute public health care in Canada. So Doug Ford brings in the privatization of many surgeries, and Justin Trudeau calls it innovation. And so we see the trajectory now and the dangerous precipice that we're on, losing this generational battle to have universal public healthcare in Canada. And that public healthcare crisis is not the only one. It's embedded in all of the intersecting emergencies that we're living through, the housing emergency, the cost of living emergency, the poison drug supply emergency, where 6 precious lives are being lost every day in this province where I live in British Columbia. 6 families and chosen or biological families ripped apart by unnecessary losses to poison drugs. The pandemic is still raging. Racism and authoritarianism are rising, and all of it is happening in a time of ecological breakdown and of climate breakdown that seems to connect the dots among all these crises. And yet, there are common threads, and there's a tremendous underwelling of energy and folks coming together to confront these crises. And one of the common features that is just undeniable in this time is the extraordinary balance of power in our society, and the power of corporations, their capture of government through lobbying, and their grotesque, cartoonish profits in this time when people are really struggling with the price of groceries, with the price of medicine, which is about what tonight is about. And we see that in the question of Pharmacare and the place of big pharma, nowhere is it more obvious than here that corporations are just grossly overpowered in our society, and we need to fight back. We need to win. We're not going to win it all at once, but we need to connect the dots. We're not going to win a transformative change. We might win a reform in the short term, but we can win a transformative reform. And national public pharmacare is that, a transformative reform, a reform that we will win against the power of corporations by holding governments to their commitments against all of the lobbyists arrayed in the back room against us. Big pharma is more consolidated and more profitable than almost any other industry. They've profiteered grossly off the pandemic. They've resisted every attempt to rein them in. They sold $17.4 billion of patented medicines in 2021 in Canada. And in Canada, we spend almost the same amount as the United Kingdom on pharmaceuticals, despite the fact that we've got half its population. Meanwhile, 11% of us, 3.4 million people in Canada, can't afford their meds. We've got the 3rd highest drug prices in the rich countries of the world, and we've got a fight on our hands where the battle lines are very clearly drawn. And we have a political moment. This is essential. The federal Liberals have promised pharmacare again and again. They even hired a former Ontario Liberal health minister, Eric Hoskins, to write the roadmap. And hello, it's national, single-payer, public pharmacare. That's the answer that they commissioned. That's the answer that is on the table. It's ready to go. Their own advisors, their own studies have have presented them with the answer, and they've committed to doing it. And now, thanks to the NDP Liberal Confidence and Supply Agreement, we have another moment where the Liberals are committed to getting a start on pharmacare this year. They're not going to do it without a fight. They're not going to do it without a movement, and that is what we're here to build. So pharmacare gets very wonky. There are complexities of pricing. There are questions of cost. There's all of the industry excuses why they can't do it. Let's strip it all away, and we're talking about people. We're talking about people who can't afford life-saving medicine. We're talking about people who go to hospital, are prescribed a drug in hospital, get the treatment, get the drug at no charge, get discharged from hospital, and then have to go and pay the third highest prices in the world for the same medication. So tonight, we're going to make it about the people. This campaign is going to make it about people. We're going to meet some of the people who have extraordinary life stories and have been active in this issue, some of them for decades. And we're going to kick off a campaign. And at the end, we're going to give you everything you need to just add water, plug in, and build power in your community to build a massive coalition and win this fight for national public pharmacare now. So let me get started and introduce you to the first person whose story will rock your screen this evening. Bill Swan is a lifelong severe asthmatic. He's a health economist. He's founder of a beautiful and moving website called facesoffpharmacare.ca. And Bill lives in Nova Scotia, where he works as a TV documentary producer. I'm so sorry to hear that as a documentary survivor myself, Bill. Terrible way to make a living. Tell me a little bit about your own story and what made you a lifelong advocate for public pharmacare in Canada.
With pleasure, Avi. I did not realize that our system was so incomplete until 35 years ago. I had finished my degree and went down to Blue Cross in Halifax to ask if I could get insurance for my drugs. And they asked me if I had a pre-existing condition. I said, well, yeah, I have asthma. It made sense. They needed to know. And they denied me on the spot. And to be honest, I went home and I was flabbergasted. And I actually thought I asked the question wrong. So I went back the next day and asked it again and was told, no, we will not cover you. I was flummoxed. I was confused. And then I got mad. So stupidly, I decided to stop taking my drugs, the drugs that kept me stable. And so that summer, I ended up in the hospital 4 times in the ER. By the 4th time, I wondered, would it not be cheaper to give me my drugs in the first place, rather than taking me out of the economy and putting me in the hospital, taking up resources? That led me back to university so I could do a thesis and also to have drug coverage. So I've been on this for a very long time, working many, many years ago with Alexa McDonough to try to bring it to the politicians here in Nova Scotia. Was basically just deflected. Ended up going back to school in Ottawa and continuing to work on pharmacare on the side. But, you know, I had to keep things going. After 25 years of working with an organization internationally, I stopped working. Was looking around for something to do and realized that the same problem that I had 35 years ago was still happening. Nothing had changed in that whole time. And in fact, it had gotten worse. So I started Faces of Pharmacare to bring stories to life of people who are so affected by this inability to get something as simple as a $20 medication every month. At some point, the Hoskins Commission, who you mentioned, they came calling and asking me to if I'd be willing to help them with the stories, and I felt this was really appropriate to have a patient asking other patients, you know, how does this really affect you? And I can tell you, a number of the stories ended up in the Hoskins Commission. They told me that the stories made a big difference. I can tell you from a personal perspective, there are some stories that when I finished writing and taking the notes, I was done for the day. I was devastated. I thought I had it bad-ish. Some of the stories I read, and they're in the report, are just hard to imagine.
Yeah,
Now, 2 years ago,
I want you to be a little bit specific about that, because like Faces of Pharmacare is a very
yes.
powerful storytelling tool, and I just dig in a little bit more on the question of the impact in real people's lives, because it is, as you know, it's a very wonky issue, Pharmacare, and but not when you can't afford your meds.
That's right. Well, I mean, one thing I should point out, and a lot of people don't understand this, our drug system is exactly the same as the American healthcare system. If you're really poor, if you're old, or if you have a really good job, you're covered. Otherwise, it is so difficult. And we see these same problems in Canada. So, for example, one of the people I interviewed, he was a vice president in a fairly big company, and his boss brought him in and said, listen, we have someone on staff, and one of their family members has a high cost drug, so we need to get rid of them. It was his wife. And to have this happen in Canada was just unbelievable. I was told another story by a person who ended up with so much in drug costs, went to the province for help, and the province said, well, you'd have to sign your house over to us for us to give you help. So these stories just happen over and over again. And that, when I did the project, when I first started Faces of Pharmacare, when I first did things for Hoskins, it was not a deep dive. I just collected these stories off the surface. So there's more and there's worse.
Yeah. Bill, I guess the other thing that I just want to touch on with you is the Hoskins report itself. You played this role in it. How do you see it, not in its detail, but in its political significance, in terms of a tool that we can use as part of this organizing effort?
Certainly, it's a useful tool for us to use. I think the real problem we had was, I feel that we had at least the insurance industry on the ropes originally. The pandemic kind of took all of the policy air to the room, and it gave, particularly insurance, as we see from the lobbying reports, it gave them the time to regroup. So we can still use it as the basis. It's still a good roadmap, but it's get people to understand the impact of it. And that's why I was really excited when the council decided that what we needed to do was focus on people, on patients, on who matters and who this is for.
Yeah, it's really striking what the pandemic did to the balance of forces around pharmaceutical big pharma, already one of the most, if not the most powerful lobbying interest. And now, Pfizer is going to make $50 billion in a single year because of just off the COVID medicine alone in 2022. This is a towering pile of money that we're against. But there is only one thing more powerful, and that's a mass movement of people. Bill, I'm really excited to introduce everyone to the other speakers. So I'm gonna move along, and I see some fantastic questions that are coming in the chat, and I want to be transparent with folks that we're not going to do a Q&A today because we have 4 extraordinary speakers and an organizing barnstorm that's going to light you on fire to get working. And this is a bit of a get to work organizing meeting. But if you have comments and questions, keep throwing them in the chat. We will gather them, we'll reflect on them. And this is not the only meeting that we're going to be doing on Pharmacare. And so we'll use any of your responses to bring your voice into future conversations. All right, I'm going to introduce our next guest, Monica Dutt, who I'm a new Twitter fan of, but I'm not going to fanboy on Monica for now. Monica is a medical officer of health in Newfoundland and Labrador, and a family physician at the Ally Center of Cape Breton. She's the past chair of Canadian Doctors for Medicare. I believe she's parked outside a lighting store for that. And I see, Monica, that you're getting that extra little bit of fill, what we call in the film industry, a little bit of fill on the front fill, which is great. You got your kiddo in the back, just like me. I know everyone's been enjoying the cameos. So this is a real thing. I mean, this is in our family lives. This is where it lives. So tell me a little bit about your passion for national public pharmacare and where it comes from your point in the world.
Thank you so much, and hi everyone. It seemed like a good idea to park in front of a lighting store, so that's where I am.
It's working.
Yeah, I really wanted to be part of this. I really love this energy that Council Canadians and so many people and groups are creating around public drug coverage and Pharmacare. And this is an issue I've really cared about for many years, mainly as a former board member and former chair of Canadian Doctors for Medicare, and now just kind of as a ongoing advocate. My interest comes primarily from my background as a family physician and a public health physician. And that gives me kind of two different perspectives. So I'd say as a public health physician or a medical officer of health, we're always trying to look at policies that can keep people healthy. And that often means kind of community-based policies, but there are definitely some really clear healthcare policies that make a lot of sense, like Pharmacare, because we know that will help people prevent them from getting ill. And then if they do have a chronic condition, it will help prevent that condition from getting worse. And then of course, as a family doctor, I see this every day at clinic today. Yet again, I'm talking to my patient, I'm calling the pharmacist, trying to figure out, even with someone who has, a really strong history of heart disease and diabetes and stroke, and she has high blood pressure, but yet she earns just too much to qualify for a provincial coverage program and not enough to afford her medication. So we try to figure out what she can pay for, which isn't what I wanted to prescribe for her, but it's what she can afford. And I know colleagues and primary care providers and health professionals across the country, we have these discussions daily, and it often makes no sense to me that people can come to see me as a family doctor. It's covered by public insurance, but what I suggest or recommend that they do and what they want to do is not the step that they're able to take. And I think another piece of this is the fact that we've largely tied access to drugs to your employment. And we've seen during the pandemic just how very unstable that was. And we already know that many people lacked drug coverage through their work, and workers who don't tend to even have that access in the first place tend to have temporary work, contract work. They change jobs more frequently. They have multiple jobs. We know this affects women more often. We know that people who are racialized are less likely to have insurance. We know that low-income households are less likely to have insurance. And another point I just wanted to mention that people might not realize, like, how many drug coverage plans we have in the country. We have over 100 government-run drug insurance plans and more than 100,000 private drug insurance plans in Canada, which really makes our system incredibly inefficient, incredibly costly. And I think probably a lot of people on this call really know why it makes sense to have a single payer system. And one of the main things is the fact that you can negotiate a better price. Anyone knows when you buy things in bulk, typically it tends to be cheaper. And if we were doing that as a country, we would remove this totally complicated network of insurance programs and negotiations. But instead of that, we have all this patchwork approach, which in the Hoskins report very clearly outlined. And then you have proposals like the Ontario portable drug benefits that have been put forward recently, that you would get a benefits package that follow you as a worker as opposed to being attached to your employer. But then yet again, it's just another fill the gap measure that does not solve our initial problem. And I was going to mention one other thing, because I saw it came up in the chat earlier, and someone mentioned the PMPRB, which is the Patent and Medicine Price Review Board, which has a
well done, well acronymized. Thank you.
And it doesn't have the most interesting title, but it really helps to keep medications affordable in Canada. And I haven't even caught up to all the news yet, but one of the board members resigned today and wrote a really scathing letter about the influence of Big Pharma and how that has been very troubling for him. And it was a major reason why he resigned from this board. And its name is Matthew Herder, and I encourage people to look up that resignation letter, because it gives a lot of really important details. And I know the Council of Canadians has been really active at looking at how strong an influence Big Pharma has been on influencing government policy. So I think those are the main
that was
comments
a
I
bombshell
wanted to
today,
make.
hey?
Yeah, for sure.
Also, someone just put in the chat, there was a fantastic investigative piece by the Breach,
Yes.
Breach Media outlet today, detailing just how Big Pharma moved in and just narrowed and diminished the scale of possible pricing controls, and then just pushed it right off the table. And we've seen commitment after commitment undermined that way. And it's just simply the power of that industry and its money, and the terrible coincidence, I think, that they had even more power in the pandemic because governments were falling over each other to secure vaccines. Monica, before I let you go, I just want to ask, I want to return to one thing that you said, because it's so fundamental to this question. Health and access to drugs lies at the intersection of all of the vulnerabilities that people experience in their lives. And you talked about it in terms of historically marginalized communities, of racialized communities, of vulnerable communities for many intersecting reasons. And this, for me, is what makes access to drugs just a fundamental issue of justice in our society. And I know as a practicing doc, and through all of the activism that you've done, this is something that you see every single day. So just take me through in just a little bit more detail how you see this issue playing out for folks who are already fighting structures of racism and discrimination and other barriers in our society.
Yeah, definitely. I think almost on kind of any health indicator that you look at, you can see the kind of systemic oppression that leads to the fact that people who are new to Canada, who are undocumented, who are racialized, who have been affected by colonization, all of those lead to the fact that health tends to be worse for all of those groups. And by not having something like universal drug coverage, we're just continuing that pattern. And, when you think in terms of, even I talked a bit about access to medication coverage to employment, that's actually not a very good system. And even though people feel really protective sometimes of their coverage, which is understandable, we know that it's more expensive to have private drug coverage. So if we can improve the system for people who have the least access, it's going to improve the system for all of us in the end. But definitely, it's that idea that if we can remove the systemic barriers that have been created by things like government policies that are driven by, profit and other factors, then we will in the end have a better health system for all of us.
Beautiful. Thank you. I feel like I need you to get your kid home now, or maybe you need to buy some lighting first. I'm not sure, but thank you so much for joining us. It is a measure of your passion and commitment to this issue that you joined us in such circumstances. I'm really happy to meet you this way, Monica, and thank you. I'm still struck by something that Bill said about the fact that we actually have an experience of the American-style healthcare system when it comes to pharmaceutical drugs in Canada. That we have this ridiculous patchwork of private insurance. This was the big battle that Tommy Douglas had in the 1960s in bringing in universal Medicare in Canada. It wasn't against hospitals. It played out in a strike with doctors. It was against the private insurance industry. And the private insurance industry runs access to affordable medication in Canada. And that's the problem right there, with Big Pharma lurking right behind those players. And we've seen who it hurts the most. And I think that our next speaker will speak powerfully to that. Rowan Burge is a queer, chronically ill advocate and organizer, is currently the provincial director for the BC Poverty Reduction Coalition, and also someone who has a big personal stake in this conversation. Rowan, I'm delighted to have you here. Tell us a little bit about your story and your connection to this issue.
For sure. Thank you so much, everyone, for having me. My name is Rowan Burge. I use she and they pronouns, and I'm calling in today from the unceded, stolen territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. I'm speaking today both as the provincial director of the BC Poverty Reduction Coalition and also as a patient advocate with personal lived experience of the burden of medication costs. So back in 2009, I was diagnosed with type 1 diabetes, which is an incurable chronic illness that requires multiple daily injections to keep myself alive, because unfortunately my body decided to stop producing insulin. So type 1 diabetes is a dangerous balancing act of trying to keep my sugars within a specific range and calculating insulin to change carbs into energy. If my sugars are too high or if my sugars are too low, there can be significant and dangerous risks that occur that range from things that are very serious, like blindness, amputation, coma, and death. So it's a very scary and exhausting reality, and it takes a lot of labor, stress, energy, and time to take care of myself. Even as a person who walks through the world with immense privileges, it's a huge burden to live with a disabling chronic illness. So imagine that in addition to that stress, there's also the huge financial burden on individuals to pay for prescription medication. So for the life-sustaining therapy of insulin, the diabetic supplies, glucose strips, and other things that I need to stay safe and well, these things have cost me personally. They cost me around $10,000 out of pocket per year. So I've now exceeded $100,000 out of pocket of my own money to pay just to stay alive. So I want to be clear that this is somebody who has health insurance. I have insurance through my work. The issue is that insurance companies are trying to make money. And so they often have things like maximum limits, co-pays for patients, and expensive medications. They will often just specifically exclude from their plan. So I had an insurance plan, for example, that just said excludes diabetic supplies, which you're kind of hooped in that case. So private health insurance and big pharma end up making billions of dollars off extorting people like myself who have chronic health conditions. And the current setup is just to kind of allow that to continue to happen. So right now I'm able to pay out of pocket, which is fantastic. But at one point a few years ago, my insurance hit the annual maximum limit that the insurance company sets. And I had to literally go ahead and make a GoFundMe account and ask for help to pay for insulin to kind of carry on forward. I don't think it should cost individuals or families thousands of dollars out of pocket per year for life-sustaining medications in a country as wealthy as Canada that absolutely has the resources to offset these costs. You know, for low-income families and people that make under a certain amount, these costs are unbearable and force folks to make terrible choices about what they have to give up to afford what should be basic human rights. In BC, the income and disability rates are still well below the poverty line, meaning that many individuals with disabilities or health conditions and their families are trapped in legislated poverty. So in addition to raising these rates, a national, fair, universal, publicly owned pharmacare system would help take the burden of these costs off folks who are already coping with illness, disease, and disability, and provide access to medications that all of us at some point will likely need to survive and thrive. You know, it's sort of been talked about, but from a cost savings perspective, it's also just basic common sense. You know, the bulk buying power is really important. To provide people with their medication now also prevents complications down the line and prevents people from having to later on access emergency rooms with larger issues that might have been avoided with adequate access to affordable meds. We also know that folks with disabilities and chronic conditions are experiencing deeper levels of poverty. We know that 1 in 5 Canadians have skipped medication because of cost, which is quite horrifying. And also, of course, skipping meds leads to long-term health impacts. And this puts the burden of cost, adds a whole lot of stress for folks, which often, ironically, worsens chronic conditions. So being stressed about how to afford my insulin actually makes my sugars worse. So it kind of creates a vicious cycle. This human suffering is completely preventable and unnecessary. And I think we can do a lot better than this for folks. Access to medication is a basic human right that we should be upholding and supporting for everyone, regardless of income, immigration status, or which province or territory you happen to live in. At some point in most of our lives, we will face disability, illness, or aging into systems that haven't been designed to care for us appropriately. Our families, our neighbors, our coworkers, and our communities deserve robust systems of care. With the pandemic, we've seen, as Monica mentioned, how precarious things can be and how there are times when our employment might change or we might need more support. And I truly believe we can build a better society that is kind and generous and takes care of folks who need this support in ways that are dignified. I think the last thing we should be worried about when contending with, you know, adjusting to life with an illness or a chronic condition is how we're going to pay for our meds. I think this should be an integrated part of a universal healthcare system. Medication should not be for making large profits for a small few at the expense of sick people, which is how it currently has been. They should be used for keeping us all well and healthy. I think the Dr. Hospin's report puts forward a pretty clear pathway and a great blueprint towards making pharmacare a reality. But I think the most important thing that I want to just highlight is that 86% of Canadians polled want pharmacare, which is an incredible amount of support. So I think together we can make that happen. And yeah, thanks again for having me speak today.
Massively popular policy. And Rowan, stick with me for 1 second. I have a follow-up question. I actually want to talk with you a tiny bit about safe supply and how it might intersect with this issue. First of all, thank you for reminding us that a national public pharmacare system, a single payer system, like a universal system, is an anti-poverty program. It's a disability justice program. It's an anti-racism program. It's a reconciliation and reparations program. And it responds to the institutional harms that are still experienced on a daily basis by too many people by actually providing something life-saving that doesn't cause people all of the stress and the costs in a time of drastic cost of living problems, which are also exacerbated by just unfathomable corporate greed, which is really, the big barrier to change. But there are also people, because we're both in British Columbia, so-called British Columbia, there are people dying in this province every single day and across the land, across Turtle Island and beyond, from poison drugs. And I was having a little exchange with Karen Ward, who you know is a fantastic drug user advocate and organizer in Vancouver, about this kind of thing we have around drugs, which is like we're all for drugs that help good people with their real problems, but against those bad drugs that bad people use for their bad ways. And it strikes me that this question of safe and universally available drugs is the thinking and the heart behind safe supply for everybody. And that pharmacare and the way that we fight it could actually see everybody in the drug universe and this question. And I know that you work in anti-poverty in British Columbia, and I want to know what you think about that.
I think that's such an important question and such an important linkage for all of us to be making. We've seen the toxic drug supply has killed thousands of people in British Columbia. So we know that criminalizing people and institutionalizing people isn't working as a tactic and as a policy tool. If we look at, folks like the Council of oh my gosh, I'm going to forget the acronym. A lot of people who use drugs and advocates of folks who use drugs have put forward really comprehensive policy, well-researched policy solutions to the drug crisis, which includes safe supply. It includes, a spectrum of harm reduction measures, including safe supply. If we know the drugs are poison, then certainly making sure that people have access to a safe supply must be better than letting folks continue to die. So I absolutely think that that issue is deeply linked with pharmacare. And I think that, socially, we've really stigmatized certain groups of people experiencing poverty, people who are unhoused, people who use drugs, and that we can't continue to sort of divide the left on these issues. We need to be providing people with supported access to the things that keep them well.
That's it. Beautifully said. Thank you so much. Let me bring in the last guest. Thanks again, Rowan. And I'm looking forward to doing this again with you. I hope soon. Erin Little, our next guest, describes herself as an undomesticated advocate fighting for farmer transparency and affordable rare disease drugs. In 2013, Erin founded the Live a Little Foundation, dedicated to finding a cure for cystinosis, directly related to the experience of Olivia, her daughter. Erin, it's great to webinar with you. And let me just open the space for you to tell us a little bit about your story and your extraordinary activism.
Oh, thank you. Thanks for everybody for being here. Our daughter, Olivia, was born healthy in 2009. And then in 2011, we almost lost her to acute kidney failure. And then later she was diagnosed with the rare disease cystinosis, which affects roughly 100 Canadian and 2,000 people worldwide. We were young, oblivious to the healthcare system and the fact that it's not very free when you need drugs. I don't know if Monica's still on, but physicians like her are game changers. We didn't have insurance at the time, and we had doctors teaching us how to make drugs to come home and give to our daughter with sodium bicarb because it was cheaper for us to make it rather than to get a prescription for it.
Wow.
And yeah, so the illusion too that we have this amazing system compared to the States is really kind of an illusion. It's a great system if your kid breaks their leg or hand, or you need minor surgeries and you don't walk out with huge bills. But as soon as you need a medication, it's a game changer. And we walked in, I never really wanted my kids to have excessive amounts of Tylenol, and all of a sudden we were walking out with boxes of medication. And it's when we brought our kids home for the first time, you look for the adult to like, who's gonna keep this kid alive. And it's kind of how we felt leaving like the hospital. Like, when is somebody gonna lift the veil and tell us what's really going on and how we deal with this? But there is no way. So and it's been a messy road along the way.
Some of the reading a little bit about your story, some of the costs and what's happened to the costs of these life-saving drugs just blew my mind. Can you tell me about what the price journey? I don't know, I feel like I've invented a marketing phrase there, but
Yeah.
like the journey that you've been through in your family around what this medication costs?
Oh yeah, the price journey. So the PMPRB kind of rolls off my tongue like cystinosis.
Right, you're good at it.
Yeah, I am. It rolls right off the tongue. It was like when someone first told us Olivia had cystinosis. I was so afraid that I wouldn't remember like how to pronounce it, let alone spell it. That's how I feel about the PMPRB. Yeah, so when Olivia's on a drug that she needs to take 4 times a day, so around the clock every 6 hours. And she was put on this drug called Cystagon right at diagnosis. And this was in 2011, it was about $5,000 per year. And then our family got involved in funding for a cure, because when you have a rare disease like cystinosis, there's no government funding and there's not a lot of big organizations raising money. So we got into raising money specifically for a cure, and we work with a great organization in the US that has done great work. And so our fundraising goes towards their researchers. And they were in the process when we kind of jumped on the bandwagon of bringing a drug called Persispi to market. They were funding this research, and a pharmaceutical company swooped in, Horizon Pharma, and basically took it to the FDA. The legwork was laid by all patients. Like, just imagine, I bet everybody on the Zoom call, however many there are on here, has bought a cupcake, went a walk, did all these things for people like me to give their kids these medications that we work so hard for. And so this pharma company, and these pharma reps, they know what they're doing. They, one of them cried in front of me saying, we'll do whatever it takes to save your daughter. We love your kids as much as you do. And we were so naive and vulnerable that we, of course, believed them. And then they took the drug to market, and it got approved. It's the same drug as Cystagon, but it's only has to be taken twice a day versus 4. So it does.
They put a little coating on it, right? They put a little time release coating on it. Yeah.
Yes.
Okay.
So I don't want to discredit. I can really not.
Well, whatever, the huge R&D innovation of putting a time release coating. Okay.
And you still have the same side effects. I mean, there is a drug burden that's a real thing, but other than that, the same side effects, same issues. And they jacked this drug up. So again, it's 2 different drugs, but the drug we were on was about $5,000 a year. And this new drug came in Canada at over $300,000 a year. And
staggering. It's just
staggering.
staggering.
It is. And
the greed, undiluted greed.
Yeah. And so, and again, I feel really selfish being almost on this panel fighting for Pharmacare, because Olivia, our family, kind of won this genetic lottery by having a child with a rare disease. And there's so few patients that the government will, thank God, cover these drugs. But I don't think that drug coverage should be a lottery draw. And this is where I get so angry with what the drug companies are doing. And if I'm going to be totally transparent here, I used to be against Pharmacare, because I thought it was going to be a roadmap for pharma to just deal their drugs to everybody at whatever they want. And learning more about it and being more involved, I learned the opposite, that it will actually bring drug prices down and make sure everybody has access. And again, there was another eye drops. Olivia also has to have eye drops. Her eye drops used to cost hundreds of dollars a year. again, thankfully covered by the government. But a new company came in. It's the same drug. It's a different treatment at over $100,000 a year. And the GM on this, from this pharma company, literally said to me, he said, "Don't worry, Erin," because I was concerned about the price. He's like, "Don't worry. We're just asking the taxpayers a little bit of money to help cover your drugs." And I in silence, I said, "What the, like, I'm a taxpayer. And how many people are you taking advantage that I am paying for their drugs that they deserve, that there's no reason to justify why it has to be that much?" And so that's where I get all intense. Fiery that it's
well,
it's,
let me end on that, because we want to get into the fiery organizing part of this, and where we all put our righteous rage into action. And like, Erin, I don't want to make assumptions about you, but you don't strike me as a person that grew up as a kind of like an anarcho-syndicalist, eco-socialist in the streets getting pepper sprayed activist. I kind of feel like this unique this unique situation with Olivia has pulled you into confronting systemic forces. And so what I want to know from you is, you talk about justice, right? Justice for all. What has this fight that you've been in done for your own worldview of seeing through the lens of your own family and your own intense personal situation, somehow seeing the connections with everybody else? Because that's the movement of the heart and of the soul that we need to ignite other people to join this fight and actually win it. You started trying to get money. You trying to get these drugs for Olivia, right? And I see you now as an advocate for Pharmacare for all. How does that journey work?
So the journey works like this. So when we had our second step into getting the eye drop issue, the drug, $500 a year to over 100,000. And we went on national news, and I had people finding my number, calling, wanted to give us money, and people that wanted to give us thousands of dollars. They couldn't afford to cover a year, but they could afford a month. And I remember being like, I knew in my heart that the government was going to do the right thing, and they did. And so we never took a penny of this. I had people wanting to do GoFundMe pages, and we couldn't do it. And I remember messaging my husband and saying, like, do I do this? What if we don't? What if they don't cover them, and Livy could go blind? And we both were just in agreement that no, we don't do this, because I was, I guess, privileged that our story got picked up, and that I have this really cute little girl in pigtails at the time. And I thought about all the other families who might not have the opportunity to have their story heard. There are more stories like ours all over. They just don't get heard. And I couldn't sit with the fact that I could have a GoFundMe, get hundreds of $1,000s probably, and then walk away and just have my drug. It is not, nobody wants to put their kid's face on a GoFundMe page to have drugs that they should just have the right to. And I think that is the bottom line. This is bigger. And I just gave to a GoFundMe campaign for somebody's medical issues. We all do it already. And we need to demand that our government make us stop paying. Remember, I told you that these GMs see us as little tidbits of taxpayers. And then on top of it, our good hearts, because we feel for these people, are paying for it again through GoFundMes. It's just not okay.
That's it. Right on. Beautiful. Beautifully put. This is about all of us. Erin, thank you so much for being here. It is time, and I have promised that we can all plug into this fight and build the power in every community, in your community where you live, where you're sitting right now on this call, and figure out how to multiply our efforts and exponentially build the power necessary to win. I'm going to turn it over to Nick and others from the council who are going to tell us how we can get involved and win this thing. And I hope that it involves me coming to your community, because if everything works out, I think we need to do a national tour about this. Take it away, Nick.
Absolutely. Thank you so much, Avi, for hosting, and to all the panelists. I'm still a little verklempt, as they say, even though I'm not Jewish. It's, you know, I'm relatively new to this issue, right? And I'm really honored that people who have been working on this and who have been living this reality for so long kind of put their trust in us and the council to raise this issue and to bring it, because it's really vitally important. I think one thing that's clear is that the facts are on our side. Like, we have report after report after report that shows this is going to save money, this is going to save lives, this is going to stabilize our healthcare system, it's going to allow us to invest in improving the working conditions of nurses and doctors and orderlies and the people who are caring for us. It's going to make our society more just. There's no reason not to do it. The government has been told by its own experts, by the Hoskins report in 2019, to do it. They've promised to do it. They campaigned on it. The Liberals campaigned on this in 2019. They made another commitment with the Supply and Confidence Agreement in 2020. And here we are almost a year later, and things are basically still at the starting line. Why is that? Why is that? It's because Health Canada is meeting with the lobbyists from these companies, from insurance companies and from big pharma almost daily. We looked at the lobbying records for the first 9 months after the Liberals committed to bringing in a national public pharmacare plan. They met with lobbyists 150 times. That's 3 to 4 times every week, per week, every week, for that span, for the 9 months after they said they were going to do pharmacare. So of course they're not doing it. Of course they're not. So we know what we're up against, right? We know we're up against the power of big money. We know they have their hooks in Health Canada. We know they have Jean-Yves Duclos running around like their errand boy. But we have a tremendous amount of power ourselves, right? We have 90% of Canadians who are on our side. We have people like Aaron, like Rowan, like Bill, in our communities. There's so many people like this, and that's an outrage. It's a horror, but it's also a strength. It's an opportunity. We have to organize with these people. We have to get these people into our movement. We have to tell them, look, there's an opportunity here. We have a weak government. We have a government that is a minority government. A lot of their MPs are hanging on by the thread of, by the seat of their pants. If we press them on this, we can win this, right? So what are we going to do? We want to bring this town hall. We want to do town halls in as many cities as possible. We want to bring this show on the road. All right? We're going to bring Avi to your town. We're going to bring Avi to your city. We're going to bring Bill to your city. We're going to bring Erin, time permitting, to your city. I don't want to make any commitments for Erin because I haven't discussed it as much with her yet. We're going to bring Rowan around. So, and other people. And there are people in your community. There are local doctors and nurses who know that this is an issue too, and they have spoken out about it. They will join you. We've been working with allies. So that's what we're looking to do in the coming months, is we want to organize as many town halls in as many communities as possible across Canada. Now, how are we going to do that? I think I would invite, we have Robin here on the team. I would invite Angela, who's our director of organizing, as well to show, I believe Mary Best is on the call, and a few other people are. There's Mary. Mary is the regional organizer for the Atlantic. I'm just curious how many people, if you can put your hands up or put something in the chat, who's on this call. And there's V. Bowie from our regional organizer for Quebec and Ontario. Who's out east? I know Bill is. Is there anyone else out east? Robin's out east. Mary. If you can put it in the chat or put your hand up if you're out east. Okay. So we're going to put in the chat, you'll see it in the chat, we're going to put a link in there. Okay. It's a link to a form. If you're interested in helping us organize a town hall in your community, and you're out east, you're going to be working with Mary, you're going to be working with me, you're going to be working with Robin. We're going to have the support of Angela too. We have a step-by-step guide to help you do that. We have 45 chapters organized across the country that are fired up and ready to work on Pharmacare with you. If you happen to have a chapter, we're going to connect you with them. So what I want people to do is I want you to go to that link and I want you to fill out your information, fill out and let us know. If you're ready, if you can come off camera and if you want to say it on camera, that would be amazing. If there are any chapter members or any supporters, if you want to bring it to your community, just write it in the chat or come off mute and say it. So that's for people out east. How many people do we have out east? We have quite a few. That's pretty good. We're at 237. The South Shore. All right. I'm just curious how many people are in Ontario. Put your hands up or put your location in the chat. That would be amazing. And I think, you know, it's important to note that, yeah, you know, I don't know, Angela, if you could show the step-by-step guide that we have. St. Catharines, Kitchener, yeah, in Montreal.
Look at all these Ontarians.
Yeah.
This is lousy with Ontarians.
Yeah. So if you're in Ontario, you're going to be working with V. If you're in Montreal, I saw some people in Montreal, I'm in Montreal, we're going to organize something together, okay? So go to that link, put your name in, fill it out. If you want to come off mute, if you want to put yourself on the camera and say, I'm ready to organize something, then do that. You know, don't be shy, although I can understand it's 200 people on a call. But
Nick, I'll just say, I can see the form as people are filling it out, and I see 2 people have already signed up. I know there's more of you who are going to come out with us. Let us know on this
let's
form.
do it.
Tell us that you're going to do it.
Don't make me come and fill out that form for you.
And I think, you know, we have the step-by-step guide. We're going to provide you with the support you need to organize this. We have window signs, we have buttons.
We got these nice buttons. I don't know if you can see this. I've been wearing it all the time.
Nice. We got buttons.
You don't have any fact sheets, do you?
We have fact sheets coming.
Well, obvious.
Really?
We have too many facts.
Fact sheets coming out of our ears.
That was a rhetorical question. I love a fact sheet when I'm getting involved in a campaign. I want ammo. I want to get out there and make the case.
Yeah. And so, yeah, and we're going to be bringing Avi out there, you know, and I think the town hall an in-person town hall, it's an opportunity, you know, to hear from people with expertise and with experience. Like we've just seen, it's an opportunity to hear Avi speak and other people. It's also an opportunity for people to talk about what they're going through, how they're experiencing high drug prices and a lack of insurance. And why we need Pharmacare. And, you know, that the town hall is going to be an organizing opportunity because that's what we need to win this fight. Okay. We have the facts, we have the moral argument on our side. We need organized and energized groups of people. I see people, we need them to get together. It doesn't take many people. You don't have to be 100 people to organize a town hall. You can be a group of 3 solid people, 5 people. That's all you need. So again, if you're interested in bringing this show to your community, to your town, I'm going to urge you to fill out the form and we'll be in touch with you. We're going to be organizing regional meetings in the coming weeks. We're going to walk people through the steps of organizing a town hall and we're going to provide you with the materials you need to do it. And I saw Robin wanted to jump in and say something.
Well, yeah, I'm just seeing we've got 4 people already signed up. I can see them on the registration page and I see a lot more chatter in the chat. So if you haven't checked out that link and let us know that you're interested in organizing a town hall, please do. Filling out that form is the best way that we're going to be able to get back in touch with you and make sure that you get all the resources that we have available. And it's going to help us connect you with other people in your community. I'm seeing in the chat already, there's a number of people in Nova Scotia who are interested in hosting town halls. And so if you do fill out that registration form, it's going to make it very easy for us to connect you with other folks nearby, which will make organizing a town hall much easier and more powerful. So let's get that form filled out.
I'm calling on my.
Okay,
I'm
we
calling
got
on
2
my
more.
people on the left.
We got 6 people.
I want to hear more from the left coast people. Where are the people west of Ontario here? Come on. We need
We have a regional organizer in
representation.
BC too, David Ravensbergen. He's not here tonight, but he will be there organizing these meetings with you.
You know, the other thing about these meetings is I've been teaching recently, and just coming into contact with more people who are concerned about the big issues. We're feeling really isolated still. People are still feeling really lonely. People are still feeling really alienated. And the power of getting together in an old-fashioned organizing campaign where we actually get together safely. I always wear my mask publicly because I'm committed to caring for more vulnerable people. And we all have vulnerabilities in our own lives. But the act of getting together right now, carefully and intentionally and building together is for me, and what I've been seeing in all of the different spaces I've been moving in of late, it's the antidote to all of the despair and the sadness and the difficulty and the isolation that we're all still feeling. And I just feel like there's something incredibly powerful about this moment. If we can get together at the community level, that we can win anything. But it starts from getting together. We remember that we are powerful, that we're not alone. And that alone, I think, is just, for me, a revolutionary act right now. So I just want to say, I'm really excited to get out there and connect with people in actual rooms safely and carefully, and with options for people who don't feel they can do that, because we can win this thing. This is a winnable fight. We just need to get together and to get it done.
Can I ask a question?
Yeah.
It's Robert from Collingwood. So I just need an idea of the end game. I understand the power of community and getting together, and it's a very powerful process. But what is the end game? How does it get won? Is it the next election? Is it a political platform? How does it get won? How do we go from the powerful communities across Canada having this huge voice, knowing what we're up against? What's the end game? How does it actually become a win?
I think the way it becomes a win is first. I mean, the first step is making people aware, because I think everyone here is already leagues ahead of everyone else, in the sense that most people don't know that the Pharmacare, the government has committed to passing Pharmacare. So I think once we get that organized group of people together in a given community, we need to start pressing the MPs. We need to start going to see them. One of the functions of the town hall itself is precisely to build that political pressure on the MP. Okay, in the step-by-step guide, we're kind of getting ahead of ourselves here, but you'll see one of the things we want to do is have a seat for the MP. You invite the MP to the town hall. You show them just how many people this problem is affecting. You show them how many people are committed to changing the system, to bringing in public single-payer Pharmacare that will cover everybody. That's how you do it, you know. And if they show up, and I think I would actually refer to Erin, something Erin told me. Her MP is a conservative, right? And I was looking at the NDP brought a bill to bring in Pharmacare in 2020, got voted down, but there was one conservative that voted for it. That was Erin's MP. Ben Lobb, all right? And she had gone, and you know, Erin's welcome to jump in if she wants to tell it, but she went to her MP and she spoke, and I think it's precisely the facts plus the direct experience plus the story of someone, you know, just how much suffering this existing system is causing people. I think you can reach individual MPs, and you can reach them even more if you show you're organized, right? If you show that it's not just you, but you've reached out to other people in the community, you found allies. And we've been doing that kind of work over the past months here at the council. We've been building a broad national alliance. We've been doing the preparatory work. And so I think once, you know, we get these town halls rolling in many different communities, it's going to start having an impact. And then, you know, when there will be a time when we have to step it up and we have to say, okay, what do we have to do next? But I think that's really the road ahead of us, is organizing these town halls and getting the pressure up. We also, Nick, I just want to add that we're in this unique political moment that you spoke about before, where a win is more tangible than it has been ever on this issue, because the Liberal government needs the NDP support to stay in power. And the NDP put getting started on universal pharmacare
in the confidence and supply agreement that is keeping our government in power. We have building grassroots pressure puts a lot more power at the back of the NDP in negotiations with the Liberals, and puts a counter pressure to the power of the pharmaceutical lobby that the Liberals are under, to water it down, to push it back, to delay it, and to ruin it once again. And so we actually have a lever that we've never had before, which is that in order to stay in power, if we can, really stiffen the NDP's spine, they can go to the wall on this one. And they will do it if they see there's enough power at the community level. And they will go hard at the bargaining table with the government. And the government needs to get this done if they want to stay in power. We've never had that lever before. And so how do we win? That's how we win.
That's exactly right, Avi. And I think another thing to consider is that the political circumstances of this moment, where inequality is growing and higher than it's been in many decades, in many people's memory, where people are really struggling to make ends meet, where inflation is incredibly high. These are similar, and political division is growing every day. These are also the conditions under which we came to have Medicare. These were the conditions under which people came together and said, look, we are sick and we need care. We can't deal with this patchwork system of nonsense hospitals and charity and bullshit. We need one system that provides for people, and we need to win it together. And so they didn't even have this confidence and supply agreement back then, but we do. And so we have this political moment where people are really suffering and coming together around that pain. And we have this incredible tool that Avi was just talking about. And so I really think this is a perfect storm for us to come together and really push for it this year. And I'm so happy that you're all here. There's 209 of us now. There were 250 of us earlier. In our rush to get to the left coast, we skipped over the prairies. And so I want to introduce Wendy Lorette, who is our prairies organizer at the Council of Canadians. I'd like you all to see her face, because if you're in the prairies, you'll be hearing from Wendy and talking to her soon about Pharmacare. So I was wondering, show of hands, folks in the prairies, is anyone going to work with Wendy, get support from Wendy to organize a town hall in their community? I did see on my list of oh boy, lots of people have been signing up. Look at you all go. We've got Medicine Hat. We've got, I'm just skipping through for the prairies now. I'm not going to skip through. We've got a lot of people signing up. Waterloo, Hamilton, Kitchener, more Kitchener, more Kitchener. A lot of people in Kitchener, Nova Scotia, South Shore, Surrey, New Brunswick, Northumberland area, Cobourg, Ontario. I'm just scrolling through here. We've got like 20 people signed up already, but I'm wondering, are there folks in the prairies here tonight who are wanting to work on this, get a town hall going in your community and work with our lovely Wendy here? Show of hands. I would take a thumbs up.
I'm waving over the Rockies at you.
Yeah.
Am I supposed to introduce myself or no?
You can, sure.
Okay. Well, I'm coming to you from Treaty 4 territory, and Sinape, Neowau, Lakota, Nakota, Dakota, and the homelands of the Métis, Treaty 4 territory. And it's my honor to be here with you. And I thank you all for being part of this incredible movement. The Council of Canadians is I'm just so honored to be part of it. And it's such a great group of people. And I want to ensure you that if there's anyone that wants to organize, I will definitely be there with you every step of the way, working with Nick to get these town halls going. We need them. Many people don't understand that there's a history too behind the Indigenous peoples of this land. And everybody thinks we get everything for nothing. We don't. We too suffer from a lack of and Medicare started in Saskatchewan, just so you know. So yeah, we have a history, an amazing history, all of us. And if we just keep stepping forward, so I keep telling everyone I work with at the council, we got something to do here, guys. We've got something
big to do here. And I'm so glad that we've got so many people to do it with us. I think it's 10 after the hour, wherever it is that you live. So I might start wrapping us up, I just want to say a few words about the council, and then I'll pass it back to Avi to wrap up the evening. The Council of Canadians is a totally independent organization. We don't take any money from corporations or governments. We never have. We get 92% of our funding from regular old people giving us $5 or $10 or $25 a month, whatever they can manage. So if you're already a member and a donor, thank you so much for that kind of support and for your political support as well. And if you're not already a member and donor, please check out, I'll drop a link in the chat here in a moment, and please consider donating, because every dollar we have will go straight into organizing these town halls to be bigger and better and more numerous, so that we can get this Pharmacare past the finish line. Thank you. I'm so delighted. The crowd tonight, yeah, thank you. Avi, I'll turn it back to you to close this up.
Thank you, Robin. Thank you everyone for coming. This is another battle in the fight of our lives. This is a battle against a really worthy bad guy. The pharmaceutical oligarchs in this company have too much power in this country, which is run too often like a company, have too much power, they have too much money, and they've got something that we need, which is access to their medications without exorbitant prices, and a system that takes care of everyone, the way our healthcare system should work. And the fight for universal public healthcare, which is going on right now, because the forces of privatization have never been bolder, have never had an easier path to taking the huge profits that they want. Capitalism always needs a new frontier to extract profits from. And our healthcare system is the big fat prize that they've been after for decades and decades. And they're closer than ever to getting their hands on it. And when we win public pharmacare, we will also push them back from the privatization of the entire healthcare system. So remember, this is a battle that is perfectly poised for this moment. It's about everyone. It's about fundamental justice. It's about righting the scales of justice in this country. It's got bad guys. It's got good folks organizing at the grassroots. And it's got a political moment, which is a path to winning that we've never had before. And that's why I'm on fire for it. That's why I've said to the council, if you folks can organize town halls across the country, I will go and do whatever I can to bring this movement together and to win this fight. And tonight was the beginning. This is where we started. So when we win, you can say I was there when we got started. Again, to Bill, to Monica, to Aaron, to Rowan, thank you so much for being part of this with me. And I can't wait to do it with you again. Have a beautiful evening wherever you are, people. And I'll see you in the registration form, which I'm going to sign up on right now. Last 5 seconds to jump in and click that link and sign up to organize a town hall in your community. Thank you all. Good night.